Well, good morning and thank you. I'm super excited to be here. Okay, let me get my bearings together here. There we go. Okay, so, all right. Well, I'm going to be talking a little bit this morning just about stigma, reversing stigma in our communities and the impact that it has on the African American community. Um, I founded our organization in 2004 because there was a need to remove barriers around recovery. Where I came from, if you had insurance in a certain particular county in Ohio, you had to remain in that county for services. So if there was limited access to treatment, that mean you had to be put on a waiting list, and in the process, people either relapsed or some people just didn't make it. So, currently, let me get this out of the way here. We just did a new strategic plan and changed our mission and values around and put a lot of work into this. So the organization's mission is to empower individuals, families, and communities to support lifestyles of recovery. We realize that it's not just the individual that needs to heal from addiction, but also, just the family and the community and the impact on it. So we want to look at things from a macro level. The values of our organization, the Northern Ohio Recovery Association, it's about integrity. And integrity, to me, is about doing the right thing, even when no one's looking. But it's deeper than that. It's about making decisions and policies that impact people, and that are not discriminatory and that have language to support what's important to us, which is addiction and mental health. Excellence is just making sure that we look over these policies and try to find loopholes prior to them being supported in our legislators, and just excellence in terms of my team and the work that they do. And of course, for me lately, the last couple of years with COVID and just the tension with the race relations, I have made a special effort to take better care of myself, and I encourage those that are in the helping profession to do that. Whatever that is. I've learned from me that my vacations work very well. Every couple months I have to get away. It seems like that's the only time that my telephone don't ring. Social justice, and that ties into the stigma and into the laws, just making sure that people that have addictions, and I think the speaker before me talked about this a little bit, that our policies, that our hospitals, that our institutions are really looking at, what is fair and equitable across the board for all populations, and that we can remove, the different biases that we find sometimes intentional, and sometimes I think not intentional, but just bringing that awareness to others. And we're going to talk about that a little later. And of course, the teamwork, and teamwork is what we're doing today. We're all here for a reason. We want to learn something. And if we work together, I think we're going to continue to see some great work across the country. Our particular vision, historically, I will tell you, was important to me, and it was to create a different level of care. And that level of care that wasn't recognized in the state of Ohio was recovery support services and recovery coaching, those kind of things. And I'm proud to say that I can remove that because that dream has literally came true. So our new vision we came up last year to establish innovative care to support continued recovery of communities we serve. And the reason I say innovative care is because the illness of addiction and the brain disease of mental health is a very challenging thing to treat. And so if we continue to have cookie cutter programs and think that we can ascribe treatment to everyone in the same way, I think we're going to do a disservice to individuals. One moment. Trying to page down, don't know why it's not working. There we go. All right. So treatment should not be the same for everyone. People are different, and we should afford them flexible interventions. When I first came into the field, and I will be the first to admit, with the limited skills that I had, everyone received the same treatment plan. what I learned over the years is that everyone is not the same. And that treatment plan, that same treatment plan that I was using on every client that I had did not work for everyone. So I'm a big advocate and fan of teaching clinicians and therapists and counselors to really sit down with people and to ask them what they need, and craft their plan out, their recovery plan out to tailor their lifestyle and not just based on our skill set. And that requires for me, myself to continue to learn. Um, so I think I heard this as well. I recognize that we had a wonderful recovery community, being that 12-step program was birthed in our backyard program of Alcoholics Anonymous. I felt like we should capitalize on that historical monument for the community. And so there was some barriers, and I'll talk about that a little bit too, around just having people that have long-term recovery being in our community. But we were birthed from the premise of support system, mentoring, and education. So I want to talk a little bit about stigma, what that is. I think we hear the term all the time. I think when we feel it, then it becomes real for us. It's this mark of shame or some kind of discredit to a person. And in order for someone to even want to access treatment services, we have to work on removing the shame and removing those feelings that make individuals feel that they're isolated and not want to access our services. And what that means to me is that we need to have a welcoming center, when individuals come in, offer them some water, offer them some fruit, or offer them some coffee, but the impact on recovery because of shame, and because of stigma is keeping individuals, to me, I won't say keeping them in denial, but I think that it doesn't help remove those barriers for those that want to access treatment, because sometimes some of the thinking is, what am I going to get? What are people going to think? And so it impacts our recovery, because it impacts our recovery success rates. Number one, because the access, just the willingness for individuals to want to access treatment is diminished because of shame. And so we have to eradicate that. The negative attitude around, and my colleague, I will say this again, who I met through this Boots on the Ground conference last year, Mark, said that many times individuals and the families, we suffer in silence. And I believe what he meant when he said that to me, is that we suffer in silence because of the shame and because of the discredit, and we don't want to talk about it. And sometimes individuals are in so much pain, but it's sometimes viewed as a negative attitude. How many parents in our community believe that there's something that they could have done different, that they could have done, not understanding that the disease is a brain disorder. And while there are social factors in our community that contribute, peer pressure and all those things, at the end of the day, the brain is going to do what it does. So the best thing we can do is try prevention strategies. Discrimination in terms of what we see. Sometimes individuals may, if they're opiate user, there's all these rules that are built into the hospitals and institutions about how to access treatment. You have to be under the influence for us to detox you, or treatment programs that someone hasn't used, and so they're in the wrong level of care. Certain hospitals, discharging alcoholics and drug addicts because they don't understand the illness. I had a story of a close friend who had a young nephew, maybe 17 years old, overdosed. They took him to the hospital. Obviously administered Narcan. He was okay, and within 8 hours, he was discharged back into the community with no resources, no report, no support, no referral. And so, just people not understanding and basically, you walk into a service center, children's services or different places that don't understand the illness. And as opposed to, the plan for reunification for the children being about addressing the recovery issue, it's about, parenting skills and things that we miss, which does not help support the direction that we're trying to go or individuals are trying to go in terms of entering recovery. Stigma continued in terms of health conditions. I've seen examples over the years where individuals with certain health conditions are treated, not properly, based on attitudes and this mark of stigma and discrimination amongst our healthcare workers and even those with disabilities. I mean, there's laws in place right now in Ohio that won't allow ex-offenders, which 70% of them in the state of Ohio have felony backgrounds. And so now they can't even access what's it called? Basically like public housing. So there's a lot of housing and law discrimination around individuals with these disabilities, just being able to find a decent place to live. And then there's, in the centers, just the barriers to enter in centers because of the wait list and things of that nature. So, I think, I don't like to talk about the problem without talking about the solution. So, in order to eradicate stigma, I think we need to do what we're doing today, which is talk openly about it, not just, amongst our profession, but also to people when we have open opportunities, just through natural conversations. I was in the store buying some cards for a program that we have, and the young lady that was waiting on me saw my shirt and she asked, I happened to have on a t-shirt, and I actually started to go home and change because I didn't feel like I was appropriate going to work, but it was one of my work t-shirts that says Nora. And she asked me about the shirt and the work that I do. And when I shared with her about the work, she shared with me about her own struggles with her son. And I sat there for about 10 minutes at the counter and encouraged her. And before it was over, I had given her my number and, just kind of helped her get through the day because you never know. And I told my staff, I said, I'm so grateful that I had this shirt on and not a suit and tie, going to the store to pick up these cards because I would have missed this opportunity to encourage that person. So we need to talk openly and candidly to, all that we know about alcohol addiction, drug addiction, and mental health disorders. I think there's an opportunity on our social media platforms. There's so many new platforms out there. Over the years, we work with our youth, particularly around technology, because they love that. So their reminders for their appointments come through text messages. Sometimes there's face messaging. Of course, we have all the parameters in place around being able to work with them. But social media is a great resource to put something together for organizations to send out a media blast or some sort of encouraging word every day or every couple of days on a time schedule, just to talk about the stigma and the openness of recovery. And I will share, my own personal story of being in recovery for 32 years. I celebrated 32 years on Sunday. Initially, when I came into recovery, there, it still is the anonymity piece around press, radio, and films. But what I realized is that if I continue to not disclose my recovery, then I'm doing a disservice to not just the profession, but to the community at large, because if our community doesn't understand that people do recover, why would they put the resources into into their budgets to support it. They will just keep putting the money into the criminal justice system. And it's a part of why we see what we do here in Ohio with the mass incarceration, and particularly of African Americans, and particularly African American males. I think another thing to consider would be just us in our ongoing education to continue to educate ourselves. Just learned something the other day about some new drug that's out here that was part of some study some years ago. Hadn't heard it, but now I got to go look into that and find out what exactly are they talking about. Because in order to stay ahead of the disease, we're going to have to continue to educate ourselves and actually look for waves and ebbs and flows, because we're finding in Ohio that cocaine is on the rise. When we have the opportunity to respond to comments and misconceptions through individuals that say things in our presence that we don't agree with, those are perfect opportunities to not aggressively, but certainly assertively assert the information that we know about stigma, and really just, take a couple minutes to educate someone and to talk about it. And finally, just being conscious of our language, things that we say and how we reinforce stigma through language, because words have power. It can mean different things to different people depending upon the context of how we use certain words. So we certainly want to be aware of our language. We want to be aware of different cultures that we're working with, because different things mean different words mean different things to people depending upon their culture. And I wanted to talk a little bit about medication-assisted treatment and the stigma around that, particularly when I first came into 12-step programming. Medication-assisted treatment in the methadone clinics, there was all these conversations around people, whether they're in recovery and whether they're not in recovery. And I finally just for myself had to draw the line and say that if a person is on medication-assisted treatment, and if it takes 2 years for the brain to sort of reverse some of the damage, if they're in counseling, if they're working their program, if they're doing what they need to do to get better, then we need to stop isolating individuals and making them feel or saying things to indicate that their recovery is not real recovery. I don't think we have that right, but I felt the need to say that because in Ohio, again, being that Alcoholics Anonymous was birthed here, there was a lot of controversy around medication-assisted treatment. I think that we've done a lot of great work over the years to eradicate that message, and we need to continue to do so. So finally, I wanted to talk about community mobilizing ideas and how we can, help to eradicate stigma in our own communities. I wanted to talk about Saul Alinsky and some of the community mobilizing models that he shared years ago. And these were some of the things that I did when I created my organization and tried to start bringing together recovery advocates and recovery coaches. So one of the things around this philosophy is the gradualism, which basically is a slow process, over a period of time, working with particular groups to organize the community. It's a gradual process built over a period of time through the engagement of the community organizer with the community people. And through this process, there are I call them mini coalitions. It's not like a revolution or anything of that nature, but it's just a subtle way of encouraging a few people over a period of time around basic concepts. So the only way these communities to build them over long term is by organizing individuals and their resources and commonly identified issues. So eradicating stigma, that is one way we can look at this, and that's one way that we can make some impact in our community. And then the infiltration, is like working within. Like if you're a part of a church or if you're a part of a union, you're already a part of that group. So you bring about information and resources and reform to the masses. So the organizer must work within the system. The trick was to penetrate existing institutions such as churches and unions and political parties by quietly gaining influence within the decision-making ranks of these institutions and to introduce changes from that platform. And so, that takes, of course, some skills, but that's another way of making impact by, maybe volunteering to create some sort of forum. And then the final one is the dialectic social change, which is very, very grassroots. We see a lot of this. There's a lot of examples. When I was putting this together, I thought about sort of like Martin Luther King and the social movement that we had back in the the 50s and the 60s, and how social change was done over time. So these are just some ideas of how we can work on mobilizing our community and eradicating stigma around mental health and addiction, and just, continuing to raise the bar on community members and also raising the bar on ourselves. So, just wanted to highlight some things. So we have collaboration, in the cities. I think that African Americans need to talk openly about our trauma and our mental health. We need not suffer in silence, and we really need to talk about it and be open. We need to hold our government officials accountable. We need to understand that our community is stressed currently, and use this opportunity to create this platform. And I think that the platform, because of COVID and George Floyd, is in the process, but we need to remember to continue to push that agenda around whatever it is. People with felonies deserve a second chance, and we need to mobilize in our communities when the opportunity arises, and sometimes not wait for a tragedy to happen. And most of all, just want to leave you with never giving up. There's been a lot of ups and downs over the years that I've worked in this field, but I've learned just to keep moving, and I have seen so many wonderful things happen, and I'm just happy to be a part of, I feel like, this movement, and I appreciate each and every one of you for what you do across the country. And I hope that this little bit of information was helpful to you. So